What's up, my Limeys? My name is Stephanie Spicer and I'm a Limey too. In my last video, I touched on the subject of co-infections, and I'd like to discuss this issue a little bit more in depth. I'm not a doctor, so this isn't medical advice, just what I've learned through reading and personal experience. Most people who have Lyme disease have one or more other chronic infectious diseases as well. Why is this? Well, the short answer is that ticks are just very dirty when it comes to germs and tend to carry around a plethora of insidious microorganisms, which they pick up from and transmit to the various animal hosts they feed on, including humans. Co-infections are in fact so common that the term Lyme disease is often used not just to describe the infection caused by Borrelia burgdorferi, but the entire soup of infections and symptoms that a person may be suffering from at the same time. This is of course incorrect, and just because you have Lyme disease doesn't mean that you have all or any of the associated co-infections. Each co-infection is a disease in and of itself and can wreak havoc on a person or animal independent of borreliosis. To make things even more confusing, many of these infections behave very similarly to Borrelia. They have many common symptoms, tend to be difficult to test for, can persist long-term after treatment, tend to cause herxing during treatment, cause high toxicity that requires ongoing detox, and unfortunately are not very well recognized or researched in mainstream medicine. Perhaps one reason why there is so much crossover between symptoms is because those researching, treating, or suffering from any one of these illnesses may not be aware of the comorbidity of others. For example, when I was making my Lyme disease symptoms video, I decided not to include shooting foot pain because it's technically a Bartonella symptom. However, since then, I've noticed that many of the symptoms that I did choose to include are also technically Bartonella or Babesia symptoms, even though I was getting my information for the video from a paper about Lyme disease. If you're treating for Lyme disease but can't get better, it may be because you have a co-infection that's standing in the way. These are different microorganisms, and though they may share a lot of similarities in manifestation, they may require different methods of treatment. I've used a Rife machine for years to treat my Lyme disease, and since I've known for a long time that I also have Bartonella, I've always run Bartonella frequencies as well, and I did herx from them. But recently I had to ask myself the question, had I really experienced any overall improvement in my Bartonella symptoms, or had they just remained basically at the same level? I've always avoided using substances to treat my Lyme disease because I really do believe that Rife machines are the best option we have at the moment for Lyme. And I didn't want antibiotic substances to send the Lyme bacteria into hiding and make my treatment less effective. However, it occurred to me that a Rife machine might not be the best option for treating Bartonella. After doing some research, I decided to break my rule and hit the Bartonella directly using substances. I'm not going to go into details because even though I have experienced some dramatic improvement, it's a bit too soon to know whether it's permanent or just temporary. What I can say is that I went through some violent Bartonella herxing, after which some symptoms which I've literally suffered from for years have completely gone away. It's important to know what you're dealing with so that you can pick up the best weapons available and fight strategically. In this video, I'm not going to go into every possible co-infection in great detail. I'm just going to mention a few of the main ones and some of their most unique symptoms. Now remember, just as Lyme's most unique symptom is the bullseye rash, which not everyone gets, you may not be experiencing these specific symptoms even if you do have any of these co-infections. I'd encourage you to just use this information as a starting point to do your own research. Bartonella. Symptoms include pain that shoots up from the soles of your feet, swollen glands, and the classic stretch mark rashes. Babesia. Symptoms include air hunger, chest and hip pain, and night sweats. Mycoplasma. Symptoms include immune and autoimmune disorders. Anaplasma and Ehrlichia. Symptoms include anemia, meningitis, and organ failure. Tick-borne relapsing fever. Symptoms include relapsing fever. Alpha-gal. Alpha-gal is a red meat allergy. Tick-borne encephalitis. Symptoms include encephalitis and meningoencephalitis. Worm-type parasites cause intestinal and other issues. Along with these specific symptoms, practically all of these illnesses manifest fatigue, headaches, sweating, chills, aches and pains, inflammation, fevers, and cognitive problems. There are other tick-borne diseases that I won't go into specifically, but I did want to mention two other issues that are extremely common to people with Lyme disease, although they're not transmitted by ticks or caused by bacteria or viruses: mold illness and heavy metal toxicity. These two work synergistically with Lyme disease and other co-infections, perhaps by contributing to the persistence of biofilm. Therefore, they should be taken into as much consideration as Lyme or any other co-infection. I'll be covering these issues more in later videos. So you may be thinking, I already have so much trouble with Lyme disease and now I'm supposed to test for and find treatments for all of these other issues too? Well, not really. Anyone who has Lyme disease should assume they have co-infections. But if you're at the beginning of treatment, it can be difficult to distinguish between them and treat them individually. As long as your current treatment is producing herxing, you're moving in the right direction. It's often only during the final stretch of treatment, when a lot of the infection has already been cleared away, that you'll start to differentiate and can begin to seek individual treatments. One phenomenon you might notice, especially during the final phase of treatment, is that Lyme disease and its co-infections seem to take turns being dominant. This has been referred to as the pathogen merry-go-round. The reason this happens is because the pathogens actually work in tandem with each other, hunkering down together in biofilms and communicating with each other via quorum sensing. When the most dominant infection is defeated or suppressed through treatment, another will pick up the baton and get to work making our lives miserable. This means we need to be vigilant to make sure we're armed and ready to attack whichever infection happens to be dominant, and to be aware of the fact that this can change at a moment's notice. One good way to know is to be alert to reduced herxing. When a treatment starts to become less effective, check what your most dominant symptoms are, and try to determine which infection has moved to the front lines, then hit that one with all you've got. The good news is that weakening one infection contributes to weakening the whole mass. You may find that after a co-infection campaign, your regular treatments work well again. If you're feeling overwhelmed after watching this video, I just want to add this encouragement. If you're treating and your treatment is working, just keep going. Rife machine treatment got me 90% better. When you hit a wall, that's when you should start considering co-infections. And if you haven't started treatment yet and don't know where to start, just do the most obvious thing. Start detox, get out of a moldy environment, start killing bacteria. You don't need to know everything all at once. You just need to start moving forward and fighting back. Wishing you all the best of luck. Keep on fighting till it's over.